According to our survey of state insurance commissioners, 5 more states will publish their rates this month, and 8 will go next month, including Colorado, Michigan, and Louisiana, where Democrats are desperately seeking to hold on to Senate seats. The premium increases will go a long way towards shaping the political environment for November's midterm elections.
Obamacare remains the medical and economic gift that just keeps on giving. Unfortunately, it is not always giving what people in need of health care really need. The latest report comes from the Sunshine State, where it's a gloomy pall cast over the insured as their new and improved premium prices are coming due any day now. And boy, will you be thrilled about it. Welcome back to MidPoint. The author of Optimal Living 360, Dr. Sanjay Jain, joins us once again today. Doctor, thanks so much for being here.
Thank you for having me.
Doctor, can I guess that you and other doctors are not surprised at all? The report that came out on Monday, Floridians, their average rates, 13.2% for 2015, and very likely that we're talking 20% or more for certain plans.
But can you be surprised of anything these days? So I really feel bad for the patients because it's like you buy something and all of a sudden a few months later you find out the price is going to go up. It feels like a bait and switch. You go and you join, get a subscription. Oh, a few months later, the premium is going to go up. So I really feel bad for the patients because they're kind of caught in the middle of all this. And hopefully things will resolve itself, but it doesn't look like it's going to happen. Things have been climbing up for the last 4 years.
What can a doctor do from your position? Your patient walks in the door. They find out that what they thought was going to be less expensive health care is now costing them even more. Aren't you simply caught in the middle at that point? You have to shrug your shoulders and say, sorry, I can't do anything about it.
Well, not only the patients, but you're right, the doctors are caught in the middle of it too. So they're coming in, they have to pay the premiums that are elevated, but at the same time, the doctor's income is going down. They're cutting rates in terms of a lot of the procedures the doctors do. So, both the patient and the doctors are caught in the middle. So what's happening is a lot of doctors are getting disenchanted. I've heard a lot of people actually deciding to leave Obamacare, just like we've heard statements and stories about people leaving Medicare. So this is an issue.
Well, talk a little bit more about that, because there's a report out on NPR that talked about the fact that Obamacare plans have shrunk payments to the doctors so much that the doctors won't be able to afford to accept Obamacare coverage. Dr. Jain, I'm going to tell you right now what the perception is out there from an awful lot of people. They look at doctors, they see doctors' offices, they see well-paid medical professionals. They think that doctors are just in there gouging the system every single day. Can you give us a little bit of the reality from the average doctor's perspective?
From the heyday of medicine for doctors is long gone. And so back in the 80s, things are going really well financially for doctors, but it's really been trending down to the point where a lot of doctors, especially primary care doctors, are really getting hit hard. My brother is actually a computer professional, and he actually makes more as an IT person than primary care physicians such as family practitioners, internists, and pediatricians. That's pretty outrageous considering you go through 4 years of medical school and incur all that debt. So I really feel bad for what's happening in medicine right now. So of course for the doctors, but also for the patients.
That low physician reimbursement rate right now, and here's what we're talking about. Can you give us an actual number here? Because again, let's look at it from Joe and Jane Beercan, who are out there basically in there taking care of their health care, and they pay over their $15, $20, whatever it is, and they say, oh, great, insurance takes care of the rest. But out of all the rest, and I just want to also point out, I've seen some bills that people have paid $15 and $20 on that have gone to $600, $700, and $800. So the patient walks away thinking, well, gee, the doctor must have got themselves $680 here.
Well, we're not that. We're actually kind of victims of the middleman, the insurance companies that really manage all that. It's very rare for fee-for-service for doctors to actually bill directly. I'll give you an example. An X-ray nowadays, you get if I read an X-ray, usually you can bill $50, $40. I might be lucky to get $7 out of that. That's the work behind a read an X-ray is about 4 years of medical school, 5, 6 years of residency, and then training beyond that. So all those years to get that $7 for reading that X-ray. So you can kind of imagine how doctors feel when they go through all this training and all that. It's very volume based now because doctors had to work harder just to make up for that income that they lost.
So then, let's look at Florida, where they say between 5 and 20%. And I mentioned earlier in the show, it's very likely that if you're going to see an increase in one place, you very likely will see it in another place. These things just happen across the board. So if we're looking at 5 to 20%, California is going to go up about 4%. What's the difference in Florida? Did they just cave in then to the insurance companies who said, pay us, and that's the way it is?
Well, I remember, I just saw Dick Morris earlier on your show, and he actually said very well that they didn't project the cost of the insurance too well. So they have more older people enrolling and less younger people. And so they have a lot more people taking on more expenses. It's like basically taking your car, which has never been to the shop, at say 10 years old, now all of a sudden you take it to a mechanic, and the mechanic says, you know what, you need a lube job, you need a whole tune-up, you need this and that. All of a sudden those costs rise up. It's like getting sticker shock at your mechanic. And I think that's what these Obamacare has basically got, is sticker shock on the expenses.
Is it not fair to say then that we're looking here about doctors who are leaving because they simply can't afford to be here? We're looking at medical students who are now coming into the field. There's a real dichotomy here. Some saying we're facing a shortage of doctors. Others are saying that they're moving into other fields simply because they know they're not going to make enough money once they graduate. Where's the reality here? Is there really going to be a shortage of doctors in a few years?
Well, the reality is in medicine it's very cyclical. So you get up waves of high shortage or in labor, and you also get a lot of people who are actually glutting the profession. So it really goes in cycles. But right now it's in a cycle where there's actually a somewhat surplus, and especially in the urban areas. Urban areas, there's a surplus of doctors, but more in the rural areas, there's actually a shortage of. So you have to actually look at it geographically, where the shortage is and where the glut is.
30 seconds left here. Can at least the patients be assured that the level of health care is going to be worth the money that they're paying, or is there still a shortage in the level of health care?
And that's a great question, because the level of healthcare is actually leveled off. And I hate to use that expression, but it's leveled off in the fact that there's less research and people are actually disincentivized to go to cutting edge because of the cost of healthcare. So when you kind of don't want to go to cutting edge medicine because of the cost and the research, that sort of levels the playing field a little bit. So there's less advancement. So in terms of the growth that you see as we did before, you're not going to have as much growth as you'd like to see.
Dr. Jain, it's great to hear a doctor who actually is willing to take it on and give us some honest answers. We appreciate your time, and I promise we'll do it again. Thanks so much.
All right, great. Take care.
All right, next hour, the man in a suitcase is in Israel, where we would expect the ceasefire to be holding. And after the break, a note to the screamers who love nothing more than to incite panic for fun and profit, and the ones who are using Ebola coming to this country right now as a main reason to get you all excited and all panicky. Telling it like it is next, right here on MidPoint, where we question everything.